Hi, my name is Francisco Chavez, and today I'm going to talk about gastric emphysema's complication. Definition: the presence of gas in the gastric wall is a finding related to several pathologies, such as ulcerative perforation, iatrogenesis, vomiting, or ingestion of caustics. Gastric emphysema is a benign condition with little repercussion and that usually occurs without incident.
Hi, this is Elliot Fishman, and welcome to our latest podcast. And this will be a very interesting one. It's on a topic actually that's one doesn't see all that often. We've seen a couple dozen cases over the years, but I just had one the other day, and so it made me take another look back at this issue. And this was a patient. I'll tell you the one I had. It was a patient, one of our surgeons, who had a Whipple's procedure and had gastric emphysema and portal venous air. The patient did have a breakdown in anastomosis, the post-Whipple's procedure. The patient did fine post-op. But gastric emphysema is something that we have seen. It occurs in a number of conditions. It can be something that's fatal. And we've also seen it where it's there and then it's gone. So let me speak to you about a little about gastric emphysema. And there'll be an article coming out about this. It was a exhibit at RSNA by Pam Johnson and Barish et al. From the Department of Surgery, and Karen Horton and Bill Scott and myself. And what is gastric emphysema? Well, it's air in the wall of the stomach. It's been called many things, from gastric emphysema to pneumatosis to emphysematous gastritis, depending on the etiology and the associated clinical findings. It's the least common location of gas in the GI tract. We all see pneumatosis coli for many reasons, including ischemia. We see small bowel air. And in an article of 86 patients with GI pneumatosis on CT, only 9% had gastric pneumatosis. And in fact, quite honestly, I think it's even lower than that. In different series, the mortality for gastric pneumatosis was high, up to 38%. And of course, the highest mortality is when multiple organs were involved: colon, small bowel, and stomach. But of course, those are cases with massive infarction typically. Now,
Applications in medicine. It occurs in chronically ill or cachectic children, adults, and they may be asymptomatic or present with abdominal distension or vomiting. Pros and cons. Pros. The identification of gastric intramural gas is not a specific pathology, but rather represents an underlying abnormality, such as infection, ischemia, increased intraluminal pressure, or severe vomiting. And cons. The term emphysematous gastritis should be used strictly when the source of gas is infection. Emphysematous gastritis is a serious form of phlegmonous gastritis.
Hello everyone, my name is Kashif Mukhtar and I'm a second year resident at St. Mary Mercy Hospital, Livonia. Today I'm going to present an interesting case of emphysematous gastritis. Emphysematous gastritis is a rare but fatal condition and the mortality can range from 60 to 80%. It is basically a diffuse inflammation of wall of stomach with gas forming organisms, often leading to gastric wall necrosis. In most of the cases, the organism is not well identified. This is a case of 70-year-old female with past medical history significant for insulin-dependent type 2 diabetes mellitus, hypertension, hyperlipidemia, and obesity. Patient presented with acute onset of left upper quadrant pain, constipation, nausea, and vomiting. The patient's pain was sharp and non-radiating, and it was 8 by 10 on pain scale. Examination revealed sick-looking lady who was older than her stated age. She also had tachycardia and decreased breathing sound bilaterally. Abdominal examination revealed mild tenderness in the left upper quadrant and bowel sounds were heard in all quadrants. In labs, she had elevated creatinine and white cell count. Her troponins were negative, but she had an elevated lactate of 3.4. Initially, a chest X-ray was done, which did not reveal any acute pathology. There was no pneumonia or pneumothorax. CT angiogram of the chest was done, which revealed bilateral segmental and subsegmental pulmonary emboli. Patient's abdominal pain was thought to be related to pulmonary emboli, and patient also had history of diabetes mellitus, and her symptoms of constipation, nausea, and vomiting were thought to be due to gastroparesis. Due to pulmonary embolism, patient was started on intravenous heparin and was given bowel rest and conservative treatment. 2 days later, patient suddenly developed altered mental status and hypoxia. Patient also had worsening of the abdominal pain and was visibly becoming more and more toxic. Patient's, patient's creatinine and her lactate also started to elevate. Patient was admitted to intensive care unit for hypoxic respiratory failure requiring intubation. Repeat CT angiogram of the chest was done, but it did not reveal any new pulmonary process. Instead, it showed a markedly dilated stomach. There was also gas within the stomach wall, concerning for emphysematous gastritis. Patient also started to have bloody orogastric tube output. Eventually, patient underwent EGD, which showed necrosis of the bowel wall. Image on the right side reveals a sagittal plane image of the CT scan. It shows that there is gas inside the wall of the stomach. Image on the left side is basically a coronal section, which also shows a gas that can be seen in the wall of the stomach.
Issue applied in Ecuador. There are no studies that demonstrate the complication of this disease in Ecuador. However, this doesn't mean that it does not happen in Ecuador. Conclusion. Gastric emphysema has a predilection for chronically ill or cachectic children and adults, with 41% mortality in adults and less than 6% mortality in children. They generally present gastric distension and vomiting with the other associated symptoms and with spontaneous resolution. Thanks for your attention.